Hello, everyone. My name is Claire Brady, and I'm reporting on Module 8, Communication, Social Marketing, and Social Mobilization, specifically Project Plan at a glance, defining the purpose and focus of the project. So today we are here to talk about project plans and what they entail. What exactly is a project plan? A project plan is a detailed document that lays out all essential elements of a project. It outlines the objectives, scope, tasks, timelines, resources, and potential risks associated with a project. Why bother with a project plan? It's like a roadmap guiding us to success. By laying out tasks and objectives, it ensures everyone knows what needs to be done. And what's the end goal? Achieving project outcomes within set constraints of time, budget, and quality. The project plan keeps us on track and focused. But above all, clarity is key. A clear end goal guides decision making and manages expectations, setting the stage for project success. Now that we understand the basics of project plans, let's dive into the purpose of your specific plan, whether it's about ending tuberculosis or any other endeavor. Firstly, we must identify the purpose and focus of our plan, outlining primary objectives and areas of emphasis. Next, we determine the end goal, aiming for specific outcomes such as reducing TB transmission rates or improving treatment success. Clarity of vision is crucial, ensuring a clear understanding of the desired outcome to drive the project forward. By envisioning healthier communities and improved quality of life for those affected by TB, we set the stage for effective planning and execution, translating clarity into actionable strategies and initiatives. So let's identify the purpose of the project by discussing the difference between purpose and objectives, using our tuberculosis awareness project as an example. So purpose is the ultimate impact or benefit of our project, such as reducing TB transmission and improving treatment outcomes. Objectives are specific changes in behavior linked to changes in knowledge and attitude. For instance, we aim to increase awareness about TB and change attitudes towards the disease by reducing stigma. With clear purposes and objectives, our efforts are directed towards meaningful outcomes and positive change in fighting tuberculosis. Let's now define the focus of our project and identifying our target audience. This is important as it helps us narrow down our approach and ensures that our efforts are directed towards the most effective strategies. When considering our options and approaches, we need to ask ourselves, which approaches will contribute most to our purpose? Have we explored all relevant options? By carefully evaluating our options, we can determine the most impactful strategies for our project. Equally important is identifying our target audience. Have we identified the specific community groups we need to engage? Understanding our target audience allows us to tailor our messages and activities to effectively reach and resonate with them. Now let's apply this to our Kusog Baga project. Our focus includes raising awareness through community events, conducting TB screening camps, collaborating with healthcare facilities, and engaging policymakers. Our target audience comprises high-risk populations such as those in overcrowded areas and healthcare workers, as well as community leaders, educators, and local influencers. By defining our purpose, by defining our focus and identifying our target audience, we can align our efforts effectively to address the needs of those most affected by tuberculosis. So let's now focus on defining the objectives of our project and how we can shape behaviors and attitudes towards TB prevention and treatment. Our first objective is to determine the specific behaviors we want our audience to adopt, modify, abandon, or reject in relation to TB. For instance, we aim to encourage individuals to seek early diagnosis and treatment, modify behaviors by promoting preventative measures like hand hygiene, abandon stigma and discrimination against TB patients, and reject behaviors contributing to TB transmission. Next, we need to consider what information is necessary for our audience to develop both positive and negative attitude towards TB-related behaviors. To promote positive attitudes, we'll highlight treatment effectiveness and share inspiring survivor stories. Conversely, to address negative attitudes, we'll dispel myths and misconceptions about TB, tackling stigma through education and awareness. By defining these objectives and providing targeted information, we aim to promote positive behaviors and attitudes towards tuberculosis prevention and treatment. Now, let's discuss the target goals we aim to achieve through our Kusog Baga project. Our first step is to establish our desired level of change as a result of our program efforts. Now, let's look at the specific goals we've set for our tuberculosis awareness project. We aim to see a reduction of tuberculosis transmission rates within our target communities. Our goal is to increase the number of individuals seeking early diagnosis and treatment for TB symptoms. We strive to decrease the levels of TB-related stigma and discrimination in our communities. We aim for the adoption of preventive measures, such as regular hand washing and respiratory hygiene practices, especially in high-risk areas. By setting these clear target goals, we can effectively measure the impact of our TB awareness project and track our progress towards reducing the burden of tuberculosis. Now let's look at some crucial additional factors for our Kusog Baga project. Firstly, let's consider what obstacles our audience might face in adopting desired behaviors. Are concerns about cost, stigma, or accessibility hindering engagement? Next, let's think about the benefits that might motivate our audience to engage in TB prevention and treatment. How can we highlight the positive outcomes of early diagnosis and treatment? Let's address competing behaviors that our audience might prioritize over tuberculosis prevention. How can we tackle these competing priorities to encourage engagement? Lastly, let's identify who the key influencers are that our audience listen to. How can we involve these influencers to support our TB awareness efforts? So, drawing from our Kusog Baga project, we've identified several factors to consider. For barriers, is the stigma surrounding TB and limited access to healthcare. The benefits, improved health outcomes and accessible treatment options. For competition, other healthcare priorities and daily routines. Influential others, so it's the community leaders and healthcare professionals. By understanding and addressing these factors, we can better tailor our tuberculosis awareness project to effectively reach and engage our target audience. So as we conclude our presentation, let's reflect on the insights we've gained regarding project planning, particularly in the context of our TB awareness project. Throughout our discussion, we've discussed the significance of meticulous project planning in achieving our objectives effectively. By defining purposes, identifying target audiences, and considering barriers and benefits, we pave the way to impactful initiatives. Through our exploration of the Kusog Baga project, we have recognized the importance of addressing specific challenges in promoting health awareness prevention. As we wrap up, I invite you to ponder the following questions based on our presentation. First, how can understanding the barriers and motivators of a target audience aid in designing effective health promotion initiatives? Second, in what ways can engaging influential stakeholders such as community leaders and healthcare professionals enhance the success of a health-related project? Okay, that's the end of my presentation, and I will talk to you in our discussion forum. Thank you.